Okay. Hey, thanks everyone for joining us again. I hope you're not sick of me yet. As you know, this is our podcast that we do every week, and hopefully, you guys are enjoying some of it on YouTube and some of the other platforms. And this is our exam Beyond the Exam Room, and I'm very excited to introduce you to Dr. Denisse Sangha, who's a phenomenal cardiologist here in New Braunfels. So, welcome so much, Dr. Sangha, for being here.
Thank you so
Appreciate it.
much. I'm excited.
I'm so excited because my patients absolutely love you.
Thank
I mean, you know that, right? I tell her all the time. My patients come back and go, "Oh my gosh, she's so nice. She actually sat down and chat with me. She was very compassionate." I hear that over and over and over again, which is I'm so appreciative you're here.
Thank you. I appreciate that.
So for us and for the viewers, for longest time, cardiovascular disease, cardiology and cardiovascular surgery has been pretty much a boys' club, and I wanted to know from you, and our viewers wanted to know, like, what got you into cardiology? How did that all start?
I had different plans. I had gotten my MPH and MBA, so I really had this idea I would be infectious disease and have this like clinic in a third world country, as was my dream. And then I did a couple of rotations in cardiology, and it felt really natural. I was like, this makes sense, and I get it. And there was a lot of opportunity to talk to patients before their event. Even as I was deciding, I'm like, I could really make a big difference here. And it just drew me in. So I just kind of walked through that door, I felt led, and put my plans to the side. So yes, definitely a boys' club, I would say.
Yeah.
But it didn't deter me at all.
That's awesome. So do you feel regret your decision about not being in a third world country and doing infectious disease, or?
Well, I don't have that to compare it to, but I certainly don't regret it. I feel like every day I feel like this is exactly what I'm supposed to do, and I wake up feeling like I'm excited. It doesn't feel like work. I tell my staff all the time, now that we've created our own environment where we can have the space that we desire to feel comfortable and at peace at work, it just doesn't feel like work at all for me.
That's
it feels awesome.
Well, I'm so proud of you for going off on your own.
Thank you.
Because it's a very scary thing to start your own business, and then now you have mouths to feed and all this other stuff. So, I'm so glad you did it. I think that's you're gonna grow leaps and bounds. And so
yeah. Thank you. It's been a year.
I know. It goes like that, doesn't it?
I know. Yes, it flew by. Yes.
Yeah, that's awesome. But I'm so glad you're here, because one of my things that I do want to talk to you about is a frustrating event for me is we all know that by far the number one killer of women is cardiovascular disease. But even in 2026, why is it that when women present with cardiac symptoms or atypical cardiac symptoms, it seems like we still miss it. We treat them differently. Do you know? How do you feel about that?
I think the presentation itself can be a little tricky, and oftentimes I think it takes the extra time to sit and listen to their stories. We often don't fall into sort of the classic angina with chest pain with exertion. Sometimes we do get the chest pain when we are upset, or when we are handling the 20 different responsibilities that women sort of carry. And I think part of it is the presentation itself. And then oftentimes we don't really take into consideration some of the risk factors that are not as known, which are autoimmune disease and sort of all systemic inflammation. So even a young girl with uncontrolled Crohn's with chest pain, we need to pay attention to that. So oftentimes I don't think we sort of take into account all of the risk factors. We kind of stick to the diabetes, cholesterol that we all know. But now we've sort of expanded knowing that everything plays a role, even stress itself. So I think those are the really two main issues, is the presentation itself and really not considering more than just the classic risk factors.
Yeah, I think that's true too, but I still feel like in my heart that there's still a difference.
Sure.
And I don't know how to close that gap. So, for example, sometimes women present cramping as anginal symptoms. But the big part that I notice is that from my perspective as a primary care clinician, like when women present with like palpitations or anxiety. Sometimes you can
Yeah.
mimic anxiety symptoms,
Absolutely.
and they go almost immediately with women to
Yes.
as anxiety, more like psychosocial. And
Yes.
if it's men, they immediately go to cardiac first.
Yeah.
But I've seen that in my own practice.
Yeah, yeah, absolutely. But just even breaking down the anxiety piece, though, that is still kind of a big deal, right? Because what we are anxious about holds information about what is heavy for us to carry over time. So these stress hormones that happen when we're anxious still play a role in heart disease, and that's sort of the whole. Sort of basis behind like my practice is considering it's not just anxiety is also information, even for women. So yeah, but you're right, automatically we think chest pain for a male, it has to be heart disease, and for a female it can't be, right? Because it's just anxiety. But yeah, there's definitely needs to be a shift in the way we treat really both parties, right? Because men can be anxious too.
Oh, for sure.
So
100%.
Yeah.
I couldn't agree more. Thank you for enlightening us with that. If you were to advise any of our people out there, what is the one thing that people seem to kindly get it over and over? They get it wrong with cardiovascular disease, you think?
I mean, I think that the most exciting part of cardiology right now is how much evolution there has been on the preventative side. I don't know if that's really out there. I mean, I see it all the time, but just how many tools we have in our toolbox to really individualize the risk for patients that can be young. I mean, the most exciting thing for me to see is a young person that has no symptoms and just comes to me because they have a strong family history and they want to know their risk.
Right.
So I think that's the most frustrating thing is if you have a heart, you need a cardiologist no matter how old you are. So like there doesn't have to be a symptom. It could just be, hey, if there's family history and you want to know your risk, there's ways to know how to prevent, like how to have prevention early before, which called primordial prevention.
Yep.
Right? So
you can actually calculate it.
absolutely.
Yeah.
Yeah. And so I think age is one of those things that's
It
frustrating.
is. Yep. I totally agree. So, you know that old term, ounce of prevention is a pound of cure. It's much more again accelerated than that, because that's the part that technology, I agree with you, it's really important. Is I would really love to catch people before they have the event, right? That's our job, is to make sure that, and then, you know, always having that discussion about statin, unstatin. There's so much bad publicity about statin.
For sure.
So how do you deal with that? I would love to get some pointers on that.
I mean, I always go, I'm very transparent with them. Number one, I always let them know I'm never going to push medication. My main job is to guide you and to keep you safe, and you make the decision on your body. When that particular topic comes up about statins, I have a printed out 3 studies, the Asprey study, Prosper study, and then the meta-analysis, the huge meta-analysis from the European Society of the kind of like debunking the statin and dementia thing, because that's really and that's a valid concern, right? Which I don't want to take anything that I think causes dementia. But just going back to the history, so I go back to the history. Statins have been out since the 1970s, and there were 60 case reports that had some acute mental fog that the FDA reported, and so that's what was extrapolated to long-term dementia, and that so far has been disproven over and over. So I try to take the time. I provide them with the resources that I have. And then I use the tools, right? We're like doing calcium scores. I'm saying, hey, you're storing plaque. This statin is is one of the things that can stabilize new plaque. And so I try to give them as many. I don't know if they just want me to stop talking and they're like, I'll take the statin. But
so you're saying that you just nag them to death until they do it. Okay.
I just provide them with as much information as possible. And they're like, man, this girl, like, she's saying so many words. I'm just going to take the pill.
I never tried nagging. I got to try nagging. See, I'm learning something. That's awesome.
if nothing else, they at least leave with like more information to Google. But I think the statin dementia thing, I mean, there were plausible concerns, and I think if we deny that totally, it makes people feel unheard.
Yeah.
So I think hearing their concerns is really important.
Yeah, so I don't know if I told you, but I'm obsessed with AI for the last 18 months, and literally every patient that comes to me here, if they don't know, they do not leave my office until they download the AI app, and I give them pointers and sheets on what to do. But it's amazing to me they have this incredible resource that they can do their own research at home, and it's the most empowering tool that I can think of. And I go through it and I said, I want you to plug this in, it'll give you guidance, and then I want you to think about it and do your own research, and let's come back and have a discussion. And that's what I try to do, because a lot of times they just feel disempowered.
Yeah.
And especially after COVID, I'll be honest, I don't know if you noticed that too.
Oh, absolutely.
Oh my God, people are like, so they you better prove it. Like they're so distrusting.
Yes, they are. It's really disheartening.
It is.
But I also I also hear this, like, I don't trust the medical system, but they appreciate the time.
Right.
And I mean, I think that's the hard part about being a doctor, is not having the luxury of time of everything that we can go through. But I think everyone softens a little bit when they feel like we're on the same playing field. So I've only had a couple people not take the medication.
Because you nag them well better than I do. I think for me, you're exactly right. I try to take myself out of the medical community and just connect on an emotional, personal level, and that's the difference, right?
Yes.
I think that's what when you make that connection. I mean, what I always tell people is, look, I have to earn your trust, and it's absolutely true, right? And one of the best ways for me is giving them tools. Instead of me feeding you, here you go. I mean, go do your own research, and let's talk about it. And if maybe you can teach me something.
Exactly, and that happens too, right?
All the time. Especially now with AI, it's like, oh my God, did you know? I'm like, then I'm there right there, Like,
yes, yeah, absolutely. I don't know if you've seen all of the AI that's happened in the cardiovascular world, but that's exciting.
It is exciting.
Yeah.
What they can, all the different things that they're going to be able to automate and read and everything else like that.
Yeah.
But the part that's hard is it's accelerating so fast. It's really almost impossible to keep up.
Yes, even what you're saying about looking up, I don't know that I'm doing a good job of that, but yes, it is exciting and kind of terrifying.
It is terrifying and exciting. It's both. I mean, the knife cuts both ways, so I agree. Yeah. But I think if we can use it the right way to empower our patients and say, look, the biggest thing is, for me, I want to have a conversation. As long as we're talking, good things happen. That's just the way, I feel. I've had some of my greatest satisfaction is when patients come in just very tunnel vision, and I have my way and everything, and I just ease them, and I said, you could be right, but can you do me a favor, just for both of our knowledge, and we can learn from each other?
Yeah.
I want you to, download this app, and then I want you to go and find answers and tell me what you think. And so it's not always 100%, but they come back at least having enough respect to say that, I'm not just telling you you're wrong, I'm just saying, let's have a conversation.
Yeah, definitely. Gone are the days of like, I'm the doctor and you do this kind of thing. Yeah, yes. Which I don't think was right to begin with, but yes.
I totally agree. That's why our patients love you. It's so funny how that happens.
And you too.
I would love to do like a women's cardiology forum.
Yeah.
In the Braunfels. I mean, like just get only the female cardiologists here, which you guys are amazing. And just have a women's symposium on cardiology for women. What do you think about that?
That's exciting. I mean, I think New Braunfels is so fortunate.
Yeah.
I don't know, maybe, I don't know exactly, but maybe 25% of cardiologists are female, or maybe something like that.
I can think of 6 female right now.
Yes,
right now.
Absolutely. So that is unheard of.
Yeah.
Because I think in general, cardiology is maybe 12% female.
Yeah. Like I said, it's a boys' club.
Yeah.
Ortho and cardiology are boys' clubs.
Yes, definitely. We're gonna make it a girls' club.
Yeah, I would love that. I would love to help you do that. Oh man, but I will tell you, there's so much things that I'm so excited about that's coming down the forefront, like you said, because I mean, it's still by far not even close to the number one killer in this country. It's not even close.
Right.
And I feel like with us having a discussion with our patients and leveraging technology and be able to catch things early, all these things that we're going to be able to do preventative, that's the part that excites me.
Yes, yeah, definitely. Just thinking about the couple of new tools is coronary CTA with the AI piece, heart flow, which I believe locally Christus will do it and Seguin has been doing it, but just knowing plaque density, soft plaque versus hard plaque, and I'm hopeful that will be sort of the mammogram of the heart one day, where that's kind of something we all do so we can know early on that we're building soft plaque. I mean, I think that would be great. But really that's the part that I've seen AI play a huge role in cardiology right now, where it's useful. And then of course, guidelines just were updated for lipids this past week, and so screening earlier is really being encouraged.
Yeah. So that you're mentioning about the soft plaque and the hard plaque, I think one of the big misconceptions people have, and I wish we had a drawing, but people think that you have 70% blockage, and then the way a heart attack occurs is that you get 80% blockage and 90%, 95, and 100%.
Right.
They don't understand the acute inflammatory response when a plaque ruptures.
Yes.
And that's why soft plaque is so dangerous.
Yes.
Is that it's just like you can only have 70%, and that plaque ruptures, and all of a sudden it's your body's response to that rupture that causes an acute event, causes an acute blockage.
Absolutely, yes. I mean, which can happen even at 10%, right? If it's unstable, and actually if it grew slowly, that'd be easy, because you could actually detect symptoms that change. But the acuteness, of course, of that plaque rupturing is a part that needs protection with usually medication support. So yes, you're right. There is this misconception of, I'll know it when I
yeah, exactly. I'm only at 50%, or when you talk to them, I'm at 95%.
Yes, exactly.
No, it doesn't work that way, dear. But I think those are some of the things that's very frustrating, that I would love your help in getting it out there, the education through podcasts, and have them look at the actual pathophysiology of how you actually a soft rupture break causes an acute occlusion. So, but I just want to thank you for being here. We could talk all day, honestly,
We can, absolutely. I'm so excited. Thank you for having me. This was great.